Well, hello and welcome to secondstreet.org's discussion series on healthcare. My name is Colin Craig, and today I'm pleased to be joined by Stephen Skyvington. Stephen is the author of This May Hurt a Bit, Reinventing Canada's Healthcare System, and he's also the owner of Polytrain, which is a public relations consulting company, and he previously worked for the Ontario Medical Association. So Stephen's been following healthcare and he's been involved in it for many, many years now. And I'm pleased that you've been able to join me today, Stephen, and tell us a little bit about your book.
It was my pleasure.
So, as I mentioned to you, we're an organization that's big on storytelling. I thought what I would do is ask you, what is the story behind your book? What made you decide to write it?
Well, I've been writing in my head for many years, and I guess I started thinking of myself as a war correspondent who was dropped behind enemy lines, and now I've come back to tell what I've seen. But the main thing that the main catalyst was I dropped dead about 3 or 4 years ago, and while being taken to the hospital, I basically said to myself, if I actually make it to the hospital and survive this, it's time to finally write it. So that's what happened, and the book and the fact I'm here, I guess, show that I made it.
Well, yeah, I'm glad you did make it because you've got some pretty interesting anecdotes and you've got an interesting perspective too on the healthcare system in your book. So I wanted to ask you, when we think about healthcare in Canada, there's lots of different components. There's long-term care, which is very different from, say, emergency services. Going to see your family physician is different from both of those, and that's different from going to see a specialist to get like a hip operation and so forth. So there's all these different components. In your opinion, do you think that we need to, shut the whole thing down, or are there parts that you think work quite well, or what's your prognosis of healthcare overall in Canada?
Well, we had like 50 years of tinkering and tweaking. I say blow the whole thing up and start again, but start with a made in Canada solution. So I'm not looking to simply take what some other country or a couple of countries have done. I think we got a lot of really smart people in Canada who could come up with our own system. But basically the problem is when they developed Medicare in the 60s with the Hall Commission, they solved the wrong problem. They worked on the problem of how to keep Canadians from going bankrupt when they have a health catastrophe. They should have been working on how do you create a healthcare system. So what we've ended up with is a sickness system. We don't have a health system. We don't have a wellness system. We don't have a nutrition system. It's a sickness system. And even worse, it's an insurance scheme. And as I say in the book, it's a badly run insurance scheme. And combine that with our politicians who are always trying to solve the political problem instead of the actual real problem. And it's a recipe for disaster. So that's why we find ourselves where we are today.
And so do you, like, when you look at the system, it's easy to see anecdotes here and there of people that are having to wait a long period of time or maybe getting bad customer service and so forth. But were there any reports that you looked at or anything that you read over the years where it kind of made you say, no, wait a second, overall, we're not doing as well as other healthcare systems in other countries? Were there any sort of big numbers or reports like that you came across?
Well, I've got about 20 pages of notes in the back of the book in which I reference a bunch of reports, obviously groups like Fraser Institute and the Canadian Institute for Health Information. But I think it was the young boy, Waleed, that's part of Dr. Brian Day's Charter Challenge, who basically our system is responsible for him being paralyzed because they felt that a very long wait for spinal surgery was acceptable. And then here in Ontario, a young boy named Bellin, who basically his parents had the choice between let him go blind and then the Ontario Health Insurance will pay for it, or spend $3,000 out of your own pocket for surgery in Ottawa that, interestingly enough, is covered by the provincial health system. I believe it's in Alberta. And that's the lunacy, of course, that, when you see these stories about individuals, it puts a human face on it. But I liken this to, and every Canadian will relate to this because we're all hockey fans. Imagine Ottawa, Montreal played 3 20-minute periods. Imagine Toronto, Winnipeg, and Calgary played 2 30-minute periods of hockey. And then imagine that Edmonton and Vancouver played 1 60-minute game. Now, hockey fans wouldn't stand for that. They think that was crazy. But that actually is how our health system is set up. It's 14 health ministries, 10 provincial, 3 territorial, and 1 federal. And it's a mess. It's not one centralized system, and that's why I say it's an insurance scheme. It's by no means a system.
Yeah, no, that's interesting you say that. I mean, we've been looking into some of the different rules for MRIs between provinces, and it's all over the map. It's very different from province to province. So yeah, it's interesting how there's so much diversity within the system, but yet there's sort of this conformity when it comes to restricting patients and what they can spend their own money on when it comes
Well,
to improving their health.
and that's because, and this came as a surprise when I was writing the book. I didn't know this. The Canada Health Act 1984 is actually a finance bill,
Mhm.
and it's not really doesn't have much to do with healthcare at all, other than the 5 principles. Interestingly enough, Tommy Douglas had 8 principles. They left out responsible, efficient, and effective, and took the other 5 of Tommy Douglas. But the problem is that we have a bill that is really a finance bill, and we have a health system that's voluntary. In other words, the provinces don't have to be a part of this, but then they get docked the money that they might allow through private clinics and creativity and innovation. And so the Canada Health Act is really the number one impediment to an innovation in Canada.
Yeah, I think it's interesting you say that because I think you're right. I think a lot of Canadians don't understand that. The Canada Health Act, as far as I understand, it says, okay, provinces, if you want money for healthcare, here's what you have to do. You have to
Mhm.
line these 5 characteristics. And it's interesting that you point out that when it came to developing those 5 principles of the Canada Health Act, they left out the most important, and that is to make sure that the system's effective and providing people with timely care. I want to just ask you about sort of the direction that we're going in. You know, a lot of people understand that we have an aging population in this country, and that's going to put a lot of stress on the healthcare system. You talk about this in your book. What do you foresee if we don't make healthcare changes? If we don't reform the system, where do we end up? Who's affected? What's the perspective from a patient or taxpayer?
Well, by 2030, about 11 years from now, we'll end up with exactly what everyone, including me, says they don't want, which is a US style 2-tier healthcare system, because 80% or more of the budget will be spent on healthcare. And, to put that in perspective, if you're okay with every road in Canada being a toll road, with every school being a private school, with there being no money for infrastructure projects, no money to run government programs, because it's all going to pay for health, as Dalton McGuinty, the former Premier of Ontario, once famously said, there'll come a time when the only ministry we can afford is the Ministry of Health, and we still won't be able to afford the Ministry of Health. And that's exactly where we're heading in roughly the next decade, unless we act now. I mean, the problem is we should have been on this 20 years ago, and now we're getting to the crisis point. If for no other reason than the 3 healthcare tsunamis I talk about in the book, obesity, uh, diabetes, and dementia, those 3 alone, any one of those 3 alone, have the chance of wiping out the treasury. And we don't even have in Canada a dementia strategy. So it's quite crazy how our so-called political leaders have been asleep at the switch. And hopefully, my goal is to wake them up so that healthcare becomes the number one issue in the run up to October's election here in Canada.
Yeah, it's certainly very discouraging that these issues have been known about for a long time. I mean, politicians have known for decades that we have an aging population and that they need to plan accordingly. But largely what they did is they spent the money. All the boomers hit the workforce in droves. They paid a fortune in taxes, and politicians spent the money and then some, because of course they ran up tons of debt, rather than putting some money aside to say, hey, when all these baby boomers get to that age where they need the healthcare system, we better have some savings aside to pay
Well,
for it.
that's what I point out in the book. We really have a serious accounting problem.
Yeah.
And for the millennials and iGens who think I don't have to worry about healthcare, I'm young, I'm healthy. Here's reality. I'm a boomer. I just turned 60,
Yeah.
and I will receive $4,000 more in healthcare services than taxes paid in my lifetime. The millennials will pay $18,000 more in tax than services received, and the iGens will pay $27,000 more in tax than healthcare services received. So you can see what a catastrophe we're heading for, and I know the young folks are asleep at the switch too. So I'm trying to wake them up because they really need to get involved and push. It's great to care about the environment, and we see the young people driving that agenda. They need to drive this agenda too, and hopefully the young people combined with the boomers and zoomers who aren't going to wait around months and years for hips and eyes and all kinds of stuff. I think between those groups, we can actually make this happen. And that's, I'm calling for a revolution. In fact, I've termed it, we need a healthcare Arab Spring in Canada. And I hope that everyone will either buy the book, get it out of the library, however you come across it, read the book, and then use that to quiz the candidates who are already starting to come to your door and ask them where they stand. And don't simply accept, well, I'm in favor of the Canada Health Act, I'm against two-tier care, because basically what they're saying to you is, I support the unsustainable status quo, and I'm gonna just stand by while the bus goes over the cliff, and we can't accept that anymore.
Yeah, no, I think it's certainly good that you're bringing some of these issues to light, because I think you're right. A lot of young people don't understand that unless we change the system, they're really getting stuck with the bill. Even my
Yeah,
generation, we're good.
very much so.
Going to get a big raw deal here. I just want to shift gears a little bit. One of the figures that you had in your book, which was pretty surprising to me, was that about 26% of family physicians have a patient or had a patient that died while on a waiting list for some kind of a procedure. Was that figure shocking to you? Like, that seemed like a pretty high number.
I was surprised it wasn't higher. Again, having worked so closely with doctors over the years, I have kind of a little bit extra access than the average person would, as far as knowing what goes on. And that combined with the incredible number of doctors who are retiring, and in many cases retiring early, and the next generation of doctors who quite rightly don't want to work 80-hour weeks, want to work 40-hour, 35-hour weeks like a normal person. And I say that part of the problem with our system is that the doctors and nurses and other healthcare professionals have worked so hard at plugging all the holes in the dikes. And so the politicians have taken advantage of that over the last 20 years and said, well, there's no problem. We get the best healthcare system in the world. Nothing to see here. And so had they let the whole thing collapse 20 years ago, like any normal person would have, we could have been on this 20 years ago. So their wonderfulness, unfortunately, has also helped, because people say to me, you got 10 solutions in your big fix section, 10 things you suggest we do. I put number one, stop lying to us. I think if I could accomplish nothing other than to get our elected officials and the civil servants and all the people in those special interest groups, the Doctors for Medicare, or the unions, whoever it might be who's in favor of the status quo, just tell the truth. Let's be honest. Let's have that famous adult conversation, and let's actually do something. Let's identify the real problem, and let's fix the real problem. But stop lying. We've had enough. We understand now that we're being lied to. I don't think there's anyone who doesn't recognize that. So let's stop lying and tell the truth. Besides which, I would argue, I've seen polls that show about 75% of Canadians are in favor of this, in favor of a hybrid system, in favor of choice. I think a political leader who came out and said, okay, here's the truth. We admit it's unsustainable. Status quo is not an option. Here's what we're going to do. We're going to bring in a hybrid system. We're going to touch the third rail, which I think is a good thing, because the train can't run at peak efficiency without you touching the third rail. I argue that our healthcare system can't either. Mm-hmm. So somebody who comes out and says that, I think, would win a landslide in the election, to be honest with you, instead of being so frightened of it. And that's the biggest problem with our political leaders, is the fear factor. They're scared of being a leader. And that's what we need, is real leadership, not leaders who lead from the middle, which in my opinion is following. You got to lead from the front. And there's a dearth of those kind of leaders right now.
Yeah. And I it's interesting, because I've been following healthcare debate for many, many years now, decades. And it seems like we have seen a bit of a shift in terms of the mindset of Canadians and understanding that things are not working and that we need reform. So I think that there is an appetite there among a large segment of society for someone to come forward with some ideas and to start having that mature discussion that you're talking about. So hopefully if people read your book, then maybe they'll start to talk to their elected officials about some of the ideas that you propose and others. And
well, that's certainly my hope.
Yeah, and get a healthy debate going in this country about how the system could be improved. Speaking of your book, like I said, it's called This May Hurt a Bit. So if any viewers are interested in getting it, I was able to pick it up at local chapters. Are there any other places where people can get your book?
Yeah, well, as I say, every Chapters in Indigo in Canada has at least 3 copies. Amazon.ca, where I believe it's the #1 bestseller in several categories. Amazon.com, which is the American, it came out in America about a month after Canada. And the Dundurn.com, the actual book publisher website. It's actually kind of cute. I started writing the book on Halloween. I finished it on April Fool's Day, which coincidentally is also the day that the Canada Health Act was launched in 1984. Um, I turned 60 on New Year's Eve, and then the book came out on Groundhog Day, February 2nd. So I'm not sure what all those dates mean when put together, but there was a kind of interesting serendipity there.
Yeah, no kidding. Well, thank you once again for joining us, and appreciate you taking a moment to share your perspective on healthcare.
Thank you. And let me just end with one last thing. I'm looking for supporters, anybody who might be interested in this concept of creating an institute for healthcare reform and innovation, which at this point is not a brick and mortar thing, but more of a virtual thing. And I've got no one backing me. I don't have unions or special interest groups behind me. But if ordinary Canadians are interested in this idea, I'm easy to find. Believe me, it's not hard to find me on Twitter or email or however you wish to find me, even through Dundurn, the publisher. But I am looking for people that could perhaps help prop me up so I can do this, because I would like to keep speaking in Canada for the whole year up till the election. And then again next year in America, as they're attempting to copy Canada's healthcare system. That's really what the Medicare for All Act is. And I'd like to do the same thing in the States next year in the run up to their November 2020 election. So anybody who wants to support me, get a hold of me. And let's actually talk about how we might make this happen, because I think it'd be great if we actually had an institute for healthcare reform and innovation, even if it's just a virtual institute for the time being.
Well, I certainly appreciate the fact that you're wanting to contribute to this debate and keep it alive, because it's an important one. So again, if viewers are interested in getting a hold of you, you can see Stephen, the spelling of his name right there. Do a quick Google search and you can get in touch. So thanks again for joining me, and appreciate your time.
Oh, it was my great pleasure. Thank you.